for listening.
Is your local partner in health. We are still in this together, and we are here for you. Sponsored by the Alameda Alliance for Health and aired by the California Broadcasters.
KDOW, Palo Alto. Business radio that goes where you go. With our mobile app, KDOW.biz. Tune in, iHeart, and the Odyssey app. AM 1220 KDOW.
Sponsored by The Way to My Heart Incorporated.
Welcome to the Heart of Innovation. 60 minutes that could save life and limb with new breakthrough ideas and innovation changing the healthcare landscape. Brought to you by Patient Advocacy Group, the Global PAD Association at padhealth.org, in partnership with Reflow Medical, the pulse of medical ingenuity. Here are your hosts for the Heart of Innovation, Emmy Award-winning journalist and founder of the Global PAD Association, Kim McNicholas, and interventional cardiologist and founder of Save My Piggies Health and Wellness, Dr. John Phillips.
Hi, everyone. Welcome to the show. In the field of care for poor circulation in the legs, known as peripheral artery disease, or PAD, there exists a profound divide between those who see limitations and those who see possibilities. And today we are going to honor a physician who has dedicated his career to exploring what is possible when others might stop trying. Dr. Marco Manzi of Padua, Italy, has built his practice on a simple yet powerful philosophy. If a patient is already facing amputation because of PAD, because of those blocked arteries in the legs, then why not try? Why not try to open them up and restore blood flow? This approach has led him to develop pioneering techniques in distal vessel revascularization that many once considered absolutely impossible. What sets Dr. Manzi apart isn't just technical innovation, though, but truly measurable results. His team maintains one of the lowest readmission rates for PAD patients in the region. Concrete evidence that going further to save a limb benefits the entire patient, the whole patient. Now, some may question whether his aggressive approach to limb salvage goes too far. But Dr. Manzi's response is pragmatic. As long as it doesn't cause further harm, the attempt itself has so much value. This philosophy has not only saved countless limbs, but has inspired interventionalists worldwide who have trained and been inspired in his lab, including our very own Dr. John Phillips. Now, Dr. Manzi doesn't just perform procedures, he truly transforms standards of care and challenges our collective sense of what is possible in limb preservation. That's why, Dr. John, I think you're going to agree that Dr. Marco Manzi is well deserving of the Global PAD Association's 2025 PAD Lifetime Achievement Award. He is the recipient. Dr. Manzi is incredible, and he's still so young. So to say he's our Lifetime Achievement Award winner, and he's yet so young, it just shows the profound impact that he's had already in his career.
100%. I can't think of a physician and a friend who's more deserving. He truly, at least in my opinion, has pioneered some techniques that have saved a lot of piggies and a lot of limbs. I can accredit him to helping develop my career, and we'll probably get into this, but about 11 years ago, I spent 5 days with him and Mariano, and they really opened my eyes to what were options and techniques to help people, particularly with the blockages in the vessels below the knee. So it's an honor to have a friend on the show from across the pond, and I know it's a little bit late there tonight, so I'm pleased as punch to have you, Marco. Thanks for joining us.
Thank you, John. Thank you, Kim. I'm really honored to be with you, and it's a surprise, but it's really a pleasure to know that at least something in my job has been useful for not only for patients, but for colleagues, for many physicians who visited me, and listening to John. And yes, I know he is now is completely different from 10 years ago, of course. And if I could if I could change something in better, very few, I am happy for this. So thank you, John. Thank you.
And I'm
This is
curious, Dr. Manzi,
still
you
one
know, going
purpose
way
of my
back
life.
in, aw.
I
I can see you're just beaming, John. This is like the best moment in the entire world. I can tell the impact that he's also had on you and in your career. And I'm curious, before I ask Dr. Manzi about his defining moment where um, you know, he realized that he needed to push further. He needed to develop new techniques. Like maybe there was one patient that led him to go, whoa, I just can't give up on patients. I'm curious from your perspective, Dr. John, the aha moment you had in his laboratory, which gave you that confidence or gave you that additional extra oomph to say, I'm not giving up on these patients. I can go further. If they're facing amputation, then why not try?
Well, I mean, when I went over there, I was about 2.5 years into practice, and really maybe a year into feeling comfortable doing some of this vascular work. But I didn't realize, it's like the I forget who. There's a French philosopher that was quoted as saying, the eyes see what the mind can comprehend. And so for me, it was kind of like I didn't really know what I didn't know, and so I go over there and into their hospital, small-ish cath lab, and they're doing is just treating all these folks that had very similar lesion patterns, and through that had very refined techniques using minimal equipment, and that is something that was just interesting to me as well. I mean, they really understand how to use a simple balloon and a wire, more so than some of the stuff we do. But just I remember we were doing a case and Marco wouldn't give up, and I'm like, at this point, we had a rapport together, and I was like, Marco or Dr. Manzi, when do you quit? And he's like, failure is not an option. And when he said that to me, I thought, okay, we can keep pushing this. We're not going to hurt this patient, and they are staring down an amputation, so we've got to keep pushing, and this is going to be okay. And we were successful, and I've taken that little nugget and that locked it away in the old mental Rolodex, and that comes out pretty frequently in my practice.
So, Marco, you know, when in your career did you have that aha moment that failure is not an option?
So I remember in this moment, the first time I decided to do something really off label. I mean, again, a young patient, diabetic patient with a terrible gangrene of the forefoot, with a very complex vascular situation, and I failed twice with this patient. So the day before the major amputation, not the vascular surgeon, the foot surgeon told me, would you like to try again the last time? Otherwise, I proceed with the major amputation. So I thought to myself, okay, I spent almost 4 hours with this guy, and I had 2 failures. Okay, let me try again, and something could happen different. And during this third attempt, I thought, well, I cannot go antegrade. I cannot go retrograde in the normal fashion. And I thought, okay, I will try to perform a retrograde puncture of the digital arteries. So it was the first patient in the world receiving this approach. And I was with Mariano, and Mariano, I still remember the eyes of Mariano when I said, okay, let's go through the digital arteries. He watched me like, are you crazy? Are you joking? But we did it, and we succeeded. And that patient still walking on his leg after 12 years. So we checked him July last year for the other leg, and only a transmetatarsal amputation. So I think that, yes, sometimes it's funny because things happen when you are not waiting for that event. So why not try again? This is my philosophy.
Thank you, Marco. We have to go to break. Stay with us. Continuing conversation with Dr. Marco Manzi. We'll be back in 2 minutes. Or maybe 3.
Thank you, Dr. John.
I was going to do the
just
Chuck
thought
Woolery
it
2 and 2.
2 and 2. You should do that. That'd be really funny. No, I just thought it was more appropriate. The voices with that beautiful story, it just seemed more appropriate. So thank you for that. That was beautiful.
No problem. Happy to. What next? How much time do we have?
I think we have 9 minutes in this segment. Christy, thank you for doing that and for the extra time. How much do we have for this next?
How much do we have with Marco?
Segment?
1 second.
We just have till we have this segment, I think is the only segment, right, Marco?
Yes, I have 12 minutes.
12 minutes.
All right.
Because also it's just so amazing that I remember sitting there, and I love Roberto Ferraresi. He cracks me up. And I can't tell whether or not at your conference, whether he is just the hired curmudgeon to contradict you in the audience, or if he really believes that you tried too hard to save the limb. Because I've been in his lab, he doesn't give up that quickly. So I'm thinking that it's just for show, but I'm not sure. But you do have some folks, right, Dr. Manzi, that and maybe that's something to get into, that it's just so
30
hard to
seconds.
believe when we see you doing it. Okay. That other people just won't try. It just doesn't make sense to me. But also maybe getting into that work versus thing would be good. Work versus personal life would be good as well.
You want me to
What do we
take it
have,
back?
10 seconds? You want to take it back?
Sure. Because
Okay.
we've got really just this segment with Marco, right?
That's it. Yeah. Oh, we have 6 minutes.
KDOW, AM 1220 KDOW.
Welcome back to the Heart of Innovation. For more on today's topic, go to theheartofinnovation.org. That's theheartofinnovation.org. Once again, here's Emmy Award-winning journalist Kim McNicholas and interventional cardiologist Dr. John Phillips.
Welcome back, everybody. Thank you for joining us. We're honored to have Dr. Marco Manzi in Italy speaking with us today, and we only have you for a short time during this radio show. But Marco, I wanted to ask you, we've talked about it and touched on it, but you pioneered some techniques that have helped people save their limbs. You've helped physicians around the world and kind of altered the course of many careers, including mine, and we're thankful. But that's a lot on your shoulders. That's a lot to balance, and I know you have a family. Can you talk a little bit about, number one, what continues to drive you to treat these folks? And number two, how do you balance that drive with the outside forces that exist, and the importance of being a family man and a good husband and father.
Huh. Okay. Yes, of course. I'm a husband. I'm a father, and I have tried in my life to balance working uh, working related events with family. But of course, I'm lucky because my wife, she's a nurse. And my wife has been a nurse in the cath lab with me in the beginning of my career. So she can understand perfectly uh, my feeling and my approach. So without her, of course, I could not reach any of the targets I have reached during my career. I have to thank her a lot. The same with my daughters. I have four daughters, not only one. I have four daughters, and so
A lot of weddings.
yes. So yes, I try to give my best in the family too, of course, but sometimes I realize that probably you can't say always the true when you promise to respect a time for a dinner um, or for particular event. This is said from a point of view, but this is a part of the game. We everybody of us um, knows that we are not doing an employee job. So there is no time in the beginning, no time in the ending, and no breaks, no. Okay, it's not a normal job. Probably
No.
it's more similar to a mission in the romantic view of the medical profession. Sorry, I forgot the first question.
Well, it's more about, you give up so much.
Me
And I
too.
love that you say it's a mission, right? But I think the first part of it was there are a lot of doctors still out there that likely would believe that you go too far to try and save a leg, that you set a bad precedent because you, as doctors, interventionalists especially, are putting your lives on the line for the sake of someone else's limbs. Because many of these procedures can last hours with intense exposure to radiation. And I know Dr. John has told me where he wanted to quickly get in and save this leg so much. He started with the antegrade approach with access at the groin going down. And he couldn't even wait for them to switch the radiation protection. And he was already looking for access to try and come up from the bottom for another, different angle on tackling the blockage. You really get focused on it. So, what sort of resistance have you faced and how do you address it?
Well, the aggressive procedure, I always um, tell people that you have to be aggressive with good sense. Good sense means that when the patient when the clinical situation needs to be aggressive, you have to be aggressive. If you are not aggressive, probably you can't really help that patient or that clinical situation. But um, to be honest, the radiological exposure when you go antegrade is very, very low, especially if you have to work in the foot or in the tibial vessel. So the flat panel is very far away from your eyes, your hands, and your head. And I tested, and there are no radiation below the apron. The problem is when you have to approach a patient from the foot. So in the retrograde fashion, you have your hands and your body, your head very close to the flat panel, at least during the first phases of the approach. So during the puncture, during the wiring manipulation to put the wire in the vessel, then you can you can find a good position. So again, the probabilities to receive an high exposure are very low. But in the beginning, so that's why it's very important to try to give your best during the formation, because if you are skilled, if you become skilled, you reduce the time you need to be exposed, because you are faster, and you are you are sure to be successful. So it's only a question of experience. That's why I really believe in the formation. This is one of the basic rule of the click meeting. So trying to give information, try to show, and try to help people to be skilled in the shortest time is possible. That's very important. That's why in the beginning, I think probably 15 years, 20 years ago, the percentage of retrograde approach in my lab was less than 3%. Now is more than 45%. Why? Because now, if you fail antegrade, you immediately you shift to a retrograde approach, because you know that it's very short time, in a very fast way, you will achieve the vessel from below, and this is only due to the experience, to the number of procedure we have. That's all. That's the rule, the main rule.
It's, Marco, we're coming up on the break, and I think we have to say goodbye. But I will just say that it amazed me, the ability that how you developed your techniques with just minimal equipment, and it taught me to be efficient. And like you said, the more you do, the quicker you get, and then the cases aren't as long, and it's just very rewarding. And I just want to thank you on behalf of Kim, as the Lifetime Achievement Award winner. You're a hell of a guy, and I hope to see you at Click sometime soon. And we really miss you, and we appreciate everything that you've done. We're going to be right back. We want you to stay with us, because Kim and I are going to continue this discussion. And I think there's a lot of talking points here that we can move forward with. So please stay with us. But Marco, thank you very much. God bless.
Thank you, John. Hope to see you in person very soon.
Thank you, sir.
Thank you so much, Dr. Manzi. We really appreciate you. Sorry, I appreciate you guys always inviting me to go. I couldn't afford the plane ticket this past year to get to. I tried, and I kept waiting till the last minute, hoping some funding would come through, and I just couldn't get that plane ticket. So I'm hoping to try again next year, if you're as gracious to have me again. But
yeah, me too, Marco. Think about, I'd love to get back there, buddy. Love it.
Okay. Thank you so much.
Thank you, Marco.
Congratulations. Dr. Manzi, and thank you from the bottom of my heart for all you
Arrivederci,
do to save life and limb.
arrivederci.
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 Thank you.
Say hi to Mariano for us too.
Yes, likewise. Cheers.
Okay, sure.
Ciao. Ciao.
Ciao.
Segment 3 is about 6 minutes, 10 seconds now. So that works out really fine.
Fantastic.
Which would be absolutely
I mean, I
beautiful.
think we should just continue the conversation. He said, having good sense and just you're not an employee, and not to belabor the point, but there's a lot to be said for the nuances of the techniques and whatnot, and their desire to persevere. Where I guess I didn't realize that he was getting some roadblocks with respect to being too aggressive. That'd be interesting to talk about if you're.
Yeah, well, I remember just
sure.
Roberto Ferraresi sitting in the audience. I don't know if he is great. If you go again, I mean, just watching him sitting in the front.
Oh yeah,
I love Roberto. He's a good time. He's just a great guy. But he sits in the front, and as Marco is sitting there talking about going, and Mariano's like, "Are you sure you want to go a little bit further? Let's throw it to Dr. Ferraresi out there in the audience and find out, Marco, sometimes you just need to stop.
No,
where are you going to go with this?
Yeah, because sometimes you have to be. Someone has to be kind of the good cop, bad cop. I mean, you have to. And it's interesting. We are kicking the idea around of having a conference in Columbus just on like cases, and I'm not exactly sure how to formulate it yet, but the techniques, you've been to a lot of conferences and they're great, but you talk about the same stuff and it's over and over. And what really gets teased out, at least in my opinion, is physicians want to learn techniques. They want to learn good techniques. They want to hear about the bad
seconds.
Whatnot. And that's kind of what Click is like, and that's what Link was like as well. It'd be nice if we could do something like that in the U.S. But nonetheless, you want to take it back, Kim?
Or
I
sure.
can.
Because I can ask you your thoughts.
Ask me. Yeah, why don't you?
800-403-9523. That's 800-403-9523.
1220 KDOW.
Welcome back to the Heart of Innovation. For more on today's topic, go to theheartofinnovation.org. That's theheartofinnovation.org. Once again, here's Emmy Award-winning journalist Kim McNicholas and interventional cardiologist Dr. John Phillips.
Hi, everyone. Welcome back to the show. What a great first half of this show, and such an honor to have a legend, the world-renowned Dr. Marco Manzi, who was honored today with the Global PAD Association's Lifetime Achievement Award through the 2025 Global PAD Impact Awards. And before the break, Dr. John, he was explaining all of the different approaches, which I think might be over the head of some of our general folks listening, and we might want to just break it down. He was talking about the extent to which he really goes and discovered is possible to try to save a leg, which I know you do as well, which is you have an antegrade approach and you have a retrograde approach. And so many doctors will try the antegrade approach, poking into an access point with a pinhole size entry into the groin area, and then trying to tackle the blockage coming down, going south, coming at it from above. And if you can't get through, a lot of doctors will just stop at the knee and say, can't get through, let's send him to amputation, or let's do bypass. But doing bypass, if you don't have healthy vessels below the knee, well, that's destined to fail in a lot of these, especially diabetic patients. So what Dr. Manzi was talking about is one of his approaches is he comes up from below. He says, can't get through coming down. Well, let's try coming up from a different access point in the calf behind the knee, or he was talking about in the digits. That was the defining moment in his career when he was working with his partner, Dr. Mariano Polania, who is also equally talented over there in Padua, Italy. But they were coming right in from the foot. Pedal access is what you call it, and coming up from below. But there still are so many doctors that will say there's not enough evidence that it's worth doing or that it's impactful. And my philosophy is, well, if someone's facing amputation, why not give it the good old try and give the patient a chance to say, okay, you've gotten me just a little bit of more blood flow. It'll heal my wound and I can walk with less pain. At least I can sleep better at night. And I'm going to be a better partner in my care. And I'm going to try and start walking. And I'm going to start trying to build those collateral vessels. And we had a patient of Dr. Marta Lobatos. Remember Marta? She was our vascular surgeon of the year. She's from Spain. And she was sharing a story with us last September, when we honored her with vascular surgeon of the year, where she said that one of her patients said, I don't care if I lose my leg. I want you to keep trying and keep trying and keep trying, not necessarily for me, but I know this is hereditary and I want you to learn something that could save the next generation, my kids, my grandkids, from having their leg amputated like me.
Yeah, I mean, there's a lot to unpack there, and during the break, I was just kind of thinking about some of the things that Marco said and that you've said, and it brought up a memory. In fact, this past week I was with a patient who she was with her daughter. Okay, so the patient is 85. She has 11 kids. I think her entire family they have so many grandkids and great grandkids and great great grandkids that when they have Christmas, they rent out like the VFW hall. Okay, so grandma's an important pillar in their family, and grandma was staring down a major amputation. And so I saw her as a second opinion, and we got her some blood flow, and she's going to keep her leg. And she was crying, honestly, and she's so thankful. And a lot of times we kind of like, not that we dismiss it, but it's just part of what you do. But it's cases like those that, at least in my mind, they keep reminding me to persevere and take on some of the challenges. Because I'll be honest, there are some cases that you're doing, you're thinking, this is, what are we doing here? There's are we rearranging the decks, the deck chairs on the Titanic? But you just need a couple of cases that kind of remind you of why you're doing this and the impact that you had. Like you had mentioned before about me canceling a case, and there are certain circumstances that happens, and sometimes you don't think about the impact that it has, but you also don't think about the impact when you just tell a patient, now there's really nothing more we can do, you're going to lose your leg. And like for us, you walk away, but that patient then suffers a major amputation and has very high morbidity and mortality. And Marco, again, like he mentioned having sense, like common sense. And you have to have common sense. I mean, you're not going to be doing something that's totally futile or puts the patient in jeopardy or puts, anybody in jeopardy or whatever. But assuming you have common sense, the procedures that we do have truly have very low mortality rates. Okay. And what do you have to lose? And to the point of the vascular surgeon, just you tried certain things, and if they don't work, try something else, and that's how you learn and that's how you evolve. And certainly Marco helped get me to that point, and now I'm able to at least share that knowledge with my partners, and then we share it at conferences and things, and you grow the piece of the pie, so to speak, and that's what's really rewarding about what we do, and that's why I'm thankful for Marco and guys like him that have kind of pioneered some of these techniques.
And coming up right here on the Heart of Innovation, I actually want to know from Dr. John the defining moment in his career where he said, I really don't want to give up on these patients. How can I learn more? I'm not going to rest on my laurels. So stay tuned. We want to hear that story. We want to hear about that patient next, right here on the Heart of Innovation on KDOW. Don't go away.
Don't we have to mention your birthday too?
That could be our last.
Okay. I mean, you only turn 21 so many times.
Exactly. And I have such a wonderful and I know that you can attest to this, and especially being a part of this, the family, that we have developed through this community,
Yeah.
and how they really came through for my birthday. And I had an unfortunate situation where my boyfriend, I guess now my ex,
Oh.
did not. It wasn't the problem that he forgot that he didn't know. He says he didn't know. He never asked if it was my birthday, but he also didn't pick up the hints. And if you Google me, I mean, it's easy to find. And after, some real heart went into his birthday, you would think that he'd want to know. And I alluded to it. Didn't happen. It wasn't that he forgot the birthday. It was just what happened after, which is, at least a good night message to say, hey, in response to mine, where I said good night, he could have responded and just said, hey, good night, sweet dreams. I love you. Happy birthday again. Let's talk tomorrow. He could have called the next day and said, how was your birthday?
30 seconds.
Nothing. And that's what bothers me. I'm pretty low maintenance, surprisingly. You would not expect that from me. I pretty much am very low. I'm a quality time person and just need a little affirmation here or there, but that's it.
Are you guys trying to work this out?
No, I just said I'm heartbroken, and if he wants to make the effort, fine, but he seems to just say, well, sorry you feel that way.
SRN News.
AM 1220 KDOW.
So, can't do anything.
Welcome back to the Heart of Innovation. For more on today's topic, go to theheartofinnovation.org. That's theheartofinnovation.org. Once again, here's Emmy Award-winning journalist Kim McNicholas and interventional cardiologist Dr. John Phillips.
Hi, everyone. Welcome back to the show. This has been a really great show. And one of my favorite parts of any of our shows is when Dr. John and I actually have a chance to just kick back, have a discussion. And I like to hear, his philosophy. I like to hear his experiences. And, Dr. Marco Manzi talked about his defining moment in his career where he realized that, failure is not an option. And we know that when Dr. Phillips said that he traveled to Dr. Marco Manzi's, and that was the first time he really heard that statement, failure is not an option, and adopted it. But Dr. Phillips, something drove you to learn more, where you realized that, there has to be more out there that we can do, that I don't like to fail. I don't like to send patients to amputation. I want to do more. What was that defining moment for you?
Well, I mean, again, I think part of it was the knowledge that I took from Marco and Mariano, and, the simple things of how they set their lab up and had the patient set up, and you set yourself up for success. And my partners that trained me, Dr. Ansel and Dr. Body and Dr. Silver, we all, we did to some degree that work, but we didn't take it to the next level. And, for me, I was kind of charged with, all right, we need someone that can do what we call critical limb interventions. And, Phillips, you look like the guy that might want to do it. And so I'm like, okay, let's give it a shot. There's a learning curve for sure. And you just have to keep trying. You try as long as you're not hurting the patient, of course. But like we've alluded to, when someone has nothing to lose, and now it's even more like the deep venous arterialization. That's like the last frontier right now, I guess. But so these folks you have nothing to lose, and you just kind of have to try. Fortune favors the brave, as they say. So for me, it was just the notion of, okay, what else can I do that's safe for the patient and potentially efficacious? And I also know that a lot of what we do below the knee, those vessels don't stay open forever. And that's what's exciting about some of the newer technologies. And thanks to Reflow for sponsoring this. But you just got to keep trying. And the one thing that I did learn too was that we kind of, like Marco had said, he switches access points very quickly. The worst thing you can do is spin your wheels going over and doing the same thing over and over. So you've got to be just
Yeah.
allow yourself to try.
And, Douglas Salisbury is in our live studio audience, and he's our chairman of our PAD Warrior Task Force, our patient task force. And he was writing in chat about really what goes through your mind as you're trying to make these determinations, kind of, do I stay or do I go? Do I keep going? Right. And I remember being in a case in Southern California with Dr. Athar Ansari in the middle of nowhere, El Centro, California. You think that you've been to the edge of the earth. I think that's it. It is literally as far as you can go south and, east in California. And in this case, he was really trying so hard with this laser. It was part of a study. It was the CEO of the company was there, and the doctor really wanted to make it work, but it was concrete. And this artery, literally, it was a calcium trail, meaning, all you could see was just calcium all the way down. And he was just slowly but surely taking the laser step by step by step by step. And I remember this vividly when he turned to the CEO and he said, "You haven't had a failed case yet in this. I don't want to be your first." And the CEO looks at him and he said, "That's just par for the course. I need to ask you a question. Do you think that if we kept going, it would benefit the patient? Will it improve this person's quality of life if we get through and we do another hour here under fluoroscopy, someone with chronic kidney disease who can barely tolerate the contrast? Is that going to do her any good?" And at that point, you might ask the question, well, is amputation better? Honestly, in some cases, amputation is treatment, and you do need to know when to say when, right?
Exactly, because there's a lot of factors that go into it. And I think Douglas was asking, what goes through your mind. And you're always, at least in my mind, you hope for the best, prepare for the worst, and you have to have bailout strategies. But over time, you get like a spidey sense, and at least for me, you kind of know like this is going to work. Because part of the issue becomes when I get through this blockage, then what am I going to do? That's where you struggle. You're like, okay, I can get through it, meaning we can get a wire across it, and with the wire is how we advance our balloons and everything else. But then what are you going to do? And those are the tough ones. And I think, to your point, do we want to send anybody for amputation? No, but sometimes that is ultimately what's going to happen, and you have to. Number one, the patient has to be aware, but number two, I think, have to decide that sometimes to fail is the right thing, or is the answer that you have to pick in the multiple choice section.
Yeah. And it really needs to be an open discussion with the patient. We do have more technologies that are available, but if someone has a wound that's not healing, we've had a patient that literally it took 2 years to heal the wound. And that's a lot of time and care and giving up your life versus, okay, well, you have your leg. That's fantastic. But we've also had patients that have said, you know what, honestly, I don't want to spend the next 2 years with wound care every few days and not being able to get out and do what I want to do. So you might think, oh my gosh, but how can you do the same things if you don't have a leg? Well, different people have different mentalities. We had Coach Tommy who was on.
Yeah.
And you remember Coach Tommy and his Santa Rosa Junior College baseball team,
Heck yeah.
right? Was
Heck yeah.
top in the nation, like top 8 in the nation, top in the state last year. And it was incredible at 85 years old. And hasn't had one of his legs for literally that long, but he was confident that that was the best decision for him to just move on, because at the time they did exhaust all options. They could have tried more, but he just was like, you know what? Let me just get on with my life. I know I can, and I know I will. And we have quite a few patients that are like that and will move on. But patients need to know that it isn't frontline treatment, that there are options available. And if someone is calling amputation anyway, then why not try? Find a doctor who is willing to try.
No, 100%. And I think there are a lot of doctors that are willing to try, and there are a lot of
Yeah, I
doctors
agree.
that are willing to get you to a doctor that is willing to try. And it's all about having a honest conversation with the patient and the family and what the expectations are. But you know, to have an amputation is a major life-changing event, and a lot of folks don't walk again, which is why it's September's PAD Awareness Month, right? And we need to get to people in their 30s and their 40s who have diabetes, who smoke, who have other risk factors, and talk to them about, you know, I was driving home from work the other day and I saw a person in a pickup truck, looked like he was in his mid 30s, cigarette hanging out of his mouth. And in my mind, it flashed back to a patient that I just saw who's now in his late 70s, who smoked for a long time. He has peripheral arterial disease. He has chronic kidney disease. He actually developed renal cell cancer and severe COPD. And it was like, man, I wish I could just take this guy who's smoking in the pickup truck, bring him to the hospital, show him what potentially your life might look like, and maybe get you to change. And that's the mission that we need to embrace, to try to get these folks just get them in a proactive fashion as opposed to reactive.
And coming up next, right here on the Heart of Innovation, we actually have a couple people in our live studio audience that don't know I'm going to call on them, that are actually helping with this mission to spread awareness for PAD. So stay tuned. A little surprise coming up next, right here on the Heart of Innovation on KDOW. Don't go away. I just thought of it. We have two of our volunteers of the year here.
Fantastic.
And
call them out. Let's go.
and Marcia was our one of our learning champions of the year, and Douglas was named as our PAD patient champion of the year for all of his efforts. And so for my birthday, I had the opportunity to spend 2 hours, and we have Joshua, who
30
is
seconds.
one of our volunteers of the year for his production, helping us spread awareness through YouTube. So do you want to take us back, and we'll go into, we have 3 volunteers.
I'm gonna ask you to share these volunteers with us, because we have 3 minutes and 50 seconds. That's a hard stop. So
yeah,
right.
Call me at 408-357-0951. That's 408-357-0951.
1220 KDOW.
Welcome back to the Heart of Innovation. For more on today's topic, go to theheartofinnovation.org. That's theheartofinnovation.org. Once again, here's Emmy Award-winning journalist Kim McNicholas and interventional cardiologist Dr. John Phillips.
Welcome back, everybody. Thanks for joining us. You know, I get myself sometimes. So we've got 3 minutes and 50 seconds left. Kim was going to surprise some of our studio audience with the PAD awards for volunteerism, but we need to surprise Kim, right? It was your birthday a couple days ago. And Douglas, you can sing, can't you, Douglas?
Oh, but you don't want to sing across Zoom. Oh, my Lord,
No,
that'll
Douglas,
be a nightmare.
come on, man. Get on. Just help us out here. 30 seconds. Can you give us 30 seconds maybe 10 seconds of happy birthday?
Happy birthday to you.
There we go.
There's Heinz.
There he is.
Happy birthday to
Hi, Marcia.
Happy birthday.
It was beautiful.
All right. So Kim, yes, many more. You know, you
And
only 21.
And
Happy birthday.
I know exactly. And I had the honor on my birthday, and it was the most incredible birthday in the world, because I had my family, my friend's family, my PAD family, I had the opportunity to celebrate all they've given to us in helping to spread awareness, from Douglas, our patient champion of the year, Marcia and Heinz, our learning champions of the year in spreading education like diaspora. And of course, we can't forget our amazing Joshua, our true volunteer of the year for production and helping us with our YouTube channel, youtube.com/the way to my heart, helping us to build that. It's where we're getting so many of our patients and supporting them and saving legs now is through our YouTube channel. And I owe that all to Joshua and how he has really helped us to not only, build out this show, but also other shows. I think we're going live every single day. He's giving up his entire September. Every day we are going live with another educational seminar for patients with PAD. So it's pretty exciting.
It is very, very exciting. I mean, it takes a village. We talk about treating people with peripheral arterial disease. That takes a village. It takes a village to raise awareness, grassroots for sure. Because again, when you tell people that the severity of this disease is like having cancer, it really people's eyes, they glaze over a little bit because they're like, "What?" So kudos to the team and all the volunteers. Wonderful, wonderful.
And we also have go ahead, Douglas.
See, it's the education. I'm on the board at Triangle Healthcare Network here. We serve 4 counties. And the first of the year, I brought up PAD. We are now, everywhere we go to do a service, I have talked to nurse practitioners about checking people's feet and pulling socks. So we were at one place 2 weeks ago, and they were pulling shoes and socks and checking people's feet and talking to people about PAD. And it's getting that awareness out there.
Yep.
And that's what we're talking about. Absolutely.
And it takes a village. It takes all of us. And that's why congratulations, you're our, patient champion of the year. And it's one of the reasons why you are, is what you're doing out there in the community. But thank you so much, everyone, for joining us. Thank you for the birthday song. Thank you, Dr. Phillips. And again, thank you to Dr. Marco Manzi for all he's doing to save life and limb. Have a great weekend, everyone.
Take care, everybody. Well done.